Usually if you have arthroscopic surgery of the knee, you've had some sort of injury. A lot of athletes have injuries. They twist the knee, they bend the knee too far, they hyperextend the knee, something, or somebody hits the knee, like in soccer, they'll cross knees together. Either way, you have a situation where something has been done to the knee. And it's not like a bruise where, you get bruised and all of a sudden you're better, and then maybe in a day or two you can go back to doing things. No, something's happened where your knee swells up, you can't get it moving, you can't put weight on it, and then you're seeing us for problems in the knee. Usually at that stage, we're going to recommend either physical therapy to try to help you through that, or an MRI. If an MRI shows some things like a meniscus tear, or some other abnormality like a ligament tear, like an ACL tear, then we may want to consider, or something floating around in your knee like a loose body, we may want to consider an arthroscopic evaluation to take a look inside, see what you got, and then maybe take some of that pathologic structures out of your knee to get your knee back to normal. This piece of equipment is the guts of an arthroscopy, whether it be shoulder, elbow, knee, ankle. This is the guts. There are different sizes, but the bottom line is this tube has a lens on it, and this is what's inside your body when we do the surgery, and we can actually take looks inside of any different little crevice we can get this into. This is actually the camera that feeds into a TV monitor that we actually look at when we're doing surgery. So even though I'm looking at your knee sometimes, most of the time I'm actually looking at a TV screen that's showing us what's exactly going on in your knee and what we can see. And then once we see it, we can make other portholes, put other equipment in there, and actually either take out like a torn meniscus, or we can reconstruct an ACL. We have other equipment that can help us do that. But this is the guts of a knee arthroscopy. Actually, it's the guts of any arthroscopy in any joint. There's smaller versions for smaller joints. This is about the biggest version we have. And basically you can see just the tube and the lens is in your knee, the camera's outside, and that's how we actually see what we're doing, even though we're not inside with our hands and seeing it directly.